Mr. Speaker, the budget announcements mean different things to different people. Many look out for what the government is planning to do to address day-to-day cost of living issues. Some look out for whether the government will do more to address their areas of concern and matters they champion. For the members of this House, the budget debate and the Committee of Supply debate provide the opportunity for us to talk about issues that are close to our hearts and to highlight areas for the government to look at more deeply. For me, it is also an opportunity to share about everyday heroes who advocate for important issues in the community, who quietly work hard to improve their lives and that of others, and in their own ways contribute to nation building. There are two people I would like to speak about today. I want to first introduce you to Dr. Chen Shiling. Dr. Chen is a medical doctor trained in internal medicine and who has special interests in dementia and intellectual disability, ID. When she was in junior college, she had the opportunity to volunteer at Mines to provide support to individuals with ID. She shared candidly that at the beginning, the experience was daunting, and after her first session, she was not certain if she would do it again. Despite her reservations, she continued to help out at Mines over the years. After graduating from medical school and becoming a doctor, she volunteered in her free time to give medical care to patients with ID. This is challenging because typically patients with ID also have multiple medical issues. Aside from that, what Dr. Chen came to realize was that it was also necessary to track the health and well-being of the parents and caregivers. Patients with ID depend on their caregivers for many things, including but not limited to compliance with medication, nutrition, and therapies. Their health largely depends on the ability of their caregivers to manage their care. This means the health and well-being of the caregivers also need to be addressed, especially as they age. Dr. Chen therefore developed a holistic healthcare approach for aging caregivers and their adult children with ID, addressing also social issues and bringing together multidisciplinary stakeholders on the same platform. This is a fairly niche area relating to healthcare, and although seemingly logical, it is a refreshing and efficient approach on the issue. Only someone in the sector and familiar with working with such families would appreciate the specific challenges they face and curate the appropriate solutions. I believe this area of work is very important. We have heard in recent times the call to provide more support for families with children with special needs. I will touch more on this in my speeches for the COS debate. I'm happy that the government has responded to this call. In particular, Minister Chan Chun Sing's and Minister Masagos Zulkifli's replies to recent PQs gave assurance that the government will continue to strengthen efforts and will work with the community to provide this support and build an inclusive society. Dr. Chen has been championing this cause of caring for patients with ID and their caregivers as a family unit for many years. She has been working with government agencies to see how this effort can be made accessible to more in Singapore. As a parent of a child with ID, I'm heartened and glad that there are people like Dr. Chen who look out for the needs of those with special needs and their caregivers. They don't only volunteer their time, but seek to find solutions to make things better for others, especially for those who are vulnerable. Dr. Chen shows how it is so important to walk the talk. She does not just give comments and expect the government to come up with the solutions, but she has come up with substantive and constructive plans, tirelessly working with partners and taking effort to implement the ideas.